And so, my name is Shakira Curry, and this is my capstone final project entitled Improving Patient Care by Employing Additional iStat Handheld Devices. And this is for Informatics 675 at Mercer University. So, point of care testing is testing that is done at the bedside in a hospital setting using a portable device. And this is just to give you a background on what type of testing I'll be focusing on. And these tests can be done in a timely fashion and can cut down the amount of time it takes to receive a critical lab results. And normally it'll take about 10 to 15 minutes, depending on how busy the lab is, to get results. If the lab technician comes up to take the blood, or if the blood is sent down with this device, it can be done in about 2 minutes since the blood is collected at bedside and tested at bedside. These results can also be directly uploaded to the patient's electronic medical record via the docking station, and this is specifically for the iStat point of care machine, so they'll be available immediately for clinician viewing. These tests can be done with arterial blood, capillary blood, or venous blood. And in the pediatric population, which is what I'll be focusing on, most of the blood gases in the general care area are done with capillary blood. There are some instances where venous blood is acceptable, and in critical care situations, arterial blood is mostly used. So the important values that the blood gas tests for are blood pH, oxygen saturation, total carbon dioxide, bicarbonate, base excess, partial pressure of oxygen, and partial pressure of carbon dioxide. So just to give you a little more background on my project, I currently work for Children's Healthcare of Atlanta, and currently we only house iStat devices, cartridges, and docking stations in areas that they're widely used. So that's in the ICUs, the emergency department, and on the respiratory care area, simply because most of the time we do blood gases there for patients with respiratory failure, either acute or chronic. So my hospital is allowing me to work with them to do some research to decide if it would be beneficial to not only house the iStat in those specific areas, but in all areas, to cut down the issue of having to run from one place to the other to get an iStat if you need a blood gas done on a floor that's not um that doesn't already have one, or to cut down time of having to send the blood down to lab, or having a lab technician come up to take the blood and send it back down to lab. So, with that being said, my formal research question would be, when employing iStat devices in both the respiratory care area and the hematology oncology area for point of care testing, lead to improved quality and efficiency of patient care. So my null hypothesis would be having iStat in both the respiratory care area and the hematology oncology area would lead to the improvement of the quality and efficiency of patient care. So my alternate hypothesis would be that it would be more beneficial to house the iStat device in one area versus the other. So the type of research that I will be conducting will be correlational research, and I will be using the archive method, which means I'll be going back and looking at previously uploaded data from the iStat device and collecting that data and analyzing it, and that's how I would get the information and decide if there is not necessarily a direct cause in the increase of improvement of patient care based on having the iStats in more areas, but if there's a correlation between the two factors. The other type of research that I will be doing will be observational research in the form of qualitative research, and I will be doing this by interviewing clinicians that would be on each of the floors and getting insight on how they are affected by either having a device in their area or not having it in their area, and how would they be affected if the device was employed in all areas, and if they have any suggestions for how we could find a solution to the problem. So for my literature reviews, I decided to pick 2 of the 6 that I use in my actual paper, to the 2 that I felt like were most relevant to my point. So the first one is an article entitled Evaluation of the ISAT Portable Clinical Analyzer for Point of Care Testing in the Intensive Care Unit of a University's Children's Hospital. And in this article, or this research, the researchers were evaluating the performance of the ISAT device and if it was as reliable as using the actual hospital's laboratory to complete the blood gases or run the blood gas results. So they used 4 types of the cartridges that are available for the ISAT device and blood samples, and tested the blood with those cartridges and also sent blood to the laboratory. And though there were differences in the results from the lab and the ISAT, they were very minimal. So it could be compared to actually doing it in the lab, and the differences were in the acceptable range. However, with this research, there was a noticeable defect in the creatinine testing, and that was only for the neonatal population, which is only one of the tests that is available with the ISAT. So what this research led to was an additional study to test strictly the creatinine testing and the results, and this led to them discontinuing the creatinine test at this particular hospital. But as far as the other tests, like the actual blood gas testing for the ISAT, it is substantially comparable to completing the test in the actual hospital laboratory. So the second article that I chose, it is called "The Rise and Fall of ISAT Point of Care Blood Gas Testing in an Acute Care Hospital," which is the area that I'm focusing on, is acute care. So this article describes the initial implementation of the ISAT device in a hospital, and it talks about how great of an investment it was, and how they focused on using blood gas testing and ionized calcium tests because they were significantly important to the acute care population and because of their quick turnaround. So they did a financial analysis to determine the cost of the implementation of the ISAT device and the amount of savings estimated within the first year of employing the device. And employing this device, the ISAT device, will only be cost effective if a substantial amount of tests were being performed. So after implementation, they continuously monitored the use of the ISAT device and the use of the cartridges, and they found that there was no significant increase in the amount of tests done after the ISAT was implemented. So this, along with a couple discrepancies in the test results, caused them to eventually cut out use of the ISAT. And I included this one to make the point of, if you're going to employ the ISAT in all areas of the hospital to make it beneficial for the organization altogether, you will have to make sure that the ISAT is being used so that you could have that turnaround, and so it could be financially lucrative for the hospital, and not just financially, in the best interest of the patients, as far as it being used more often. So my proposed data collection for this project would be, I would first collect data on each area's justification for having an ISAT. Why does the respiratory care area need the ISAT in-house? Why does the hematology oncology area need the ISTAT in-house? So once that data is collected, I'll collect the volume or the number of blood gases being done in each area in a 3-month period. That will only include the blood gases done on the ISTAT device. So then I will collect data on how many of all of those tests done, how many of them are failed. And that means if it's not enough blood collected, the cartridge is mishandled, the device is mishandled, the cartridge is overfilled, or if the iStat has a dead battery, it needs to be docked, or any other device malfunction can lead to a failed test. So I would collect the data on how many failed tests there were for each area. Also, I would collect user data, and this will be how many clinicians are trained and registered to use the iStat device, and of those users, how many are actually performing the iStat testing with the blood gas in that 3-month period, because you can have users that are trained and tested and registered to use the device but not actually using it because they don't have that many tests. Also, of those number of gases that they are completing, how many of those clinicians are completing them correctly as they were trained. And then the last form of data collection would be the interviews that I would do with the clinicians just to get their feedback and input on how they are affected by having the iStat or not having it. And these are my references.